Hi there, my name's Dermot, and I'm an addiction counselor and a recovery coach. And I put a few lectures together on YouTube here for, I suppose, people who I would work with in early recovery and anybody else who would be interested or who would find that they're affected by different, I suppose, symptoms that you would find, character defects, etc., behaviors, feelings that you would get in early recovery. So today I'm just going to cover depression and just go run through depression, explain that a wee bit. If you want more information, by all means, there's plenty more out there, in more detailed information you can get. This is just really a kind of synopsis or a run through. Right, so we'll start off with what is depression? Well, as an emotion, depression, as I say, is a normal feeling or low mood experienced by everybody. So we all have felt depressed. We all do feel depressed, and we always will feel depressed. Again, it's part of life. You can't be happy all the time. Sometimes depression is a signal to say to you that something is wrong, you need to change. So it's there for a reason. So the feeling of depressed or feeling depressed is actually not that bad. It's not great to feel depressed at the time, but it does lift and moods do change. As a medical condition, clinical depression is a diagnosis and is characterized by a mixture of physical and psychological symptoms. So it's diagnosed normally by a doctor, a GP, or a psychiatrist. So, if you are suffering from depression or your depression is not lifting or your mood is staying low, then, it's advisable to go and get help or go and get diagnosed. The difference between depression and clinical depression is it's symptomatic and diagnosed through persistence in time. So again, you're not just going to wake up one day and say, "Oh, I've got clinical depression," because you're feeling low. You have to kind of monitor it over a period of time and see how your mood is and how it's getting on. Because again, as I said, we all can feel depressed. We all have felt depressed. Depression can last a day, a couple of days, all depends on what's going on for you. So it's not automatically clinical depression because you're feeling depressed. So different signs of depression. In fact, a person suffering from depression, I suppose, can, experiences the following symptoms. So feeling of hopelessness, emptiness, helplessness, just tired, lethargic, erratic sleep or too much sleep or too little sleep, eating patterns, not eating, eating junk food, eating irregularly, overeating maybe, emotional mood swings, crying a lot, not knowing why you're crying, becoming agitated and irritable, loss of temper. Again, high use of alcohol and drugs to numb the pain. We think that'll take it away. Isolation is a big one. Most people who are feeling depressed will go away and try be by themselves, which is probably the worst thing they can do because that just makes it worse. And headaches, stomach aches, other aches in your body. Some people can feel so depressed that they even get diarrhea. Feeling a void inside you, feeling an emptiness, anxiety, anxiousness, worry, a loss of interest in life activities, and even suicidal. So as I say, feeling depressed, again, doesn't necessarily mean that you're suffering from clinical depression. Look, if you've had a bereavement or a huge loss in life, you're going to feel depressed for a good period of time afterwards. It doesn't necessarily mean you're going to have clinical depression, but your mood will be low, and that is understandable. So, just looking at that, different things in life can affect us in different ways. When you feel depressed or you feel low, the best thing to do is talk about it. Talk about how you're feeling. You might not know why you're feeling the way you are, but just talk about how you're feeling. And again, find someone who will listen to you, who would understand or empathize with you. So don't just grab anybody who look at you strangely. So it is good to try and talk the problem out because, as I say, a problem shared is a problem halved. So why would I feel depressed? And again, as I said, for a whole different reasons, people will feel depressed. Loss of job, a breakup of relationship, medical diagnosis, fines, bills, bereavement, grief, loss, change, weather, you name it. Lots of different things can make us or make you feel depressed or make me feel depressed. So it just depends. Some people will get depressed about some things, while other people won't be affected by that. But just chops and changes with everybody. No two people are the same. Unresolved negative issues and experiences from the past, and that's a big one as well. Things like post-traumatic stress disorder, even abuse in the past, childhood abuse, unresolved grievances or bereavements that you haven't actually processed properly or gotten through. So there's a lot of things from the past that can hold you back and make you feel depressed because you haven't dealt with them, or you're stuck and you're unable to deal with them. That again, like clinical depression, is important to get that checked as well, because if you do suffer from PTSD, you do need to get specialized therapy for that. Alcohol and drug abuse. And again, they go hand in hand. Alcohols and drugs are sedatives. They can bring on depression. They make you feel depressed. Yes, they might alleviate the feeling at that time, but the next day you're going to feel even worse. For a lot of people who would feel depressed will resort to alcohol and drug abuse to take away the pain. So what help is there? Again, feeling depressed, as I say again, is a normal feeling. Talking about it with your family, friends, sponsor, peer group, anybody else who you feel will listen to you and understand you, that's the best thing to do. There's no problem is too big that doesn't have a solution to it. Sometimes when you internalize it and hold it in you, you think this is just too big and nobody can help you, because there's no way anybody can help you. But once you start to talk it out, you will find that it's not half as big as what you thought or felt it was. And other people are able to reach out and other people are able to help you, because a lot of people do go through the same things, feel the same way at times. So everybody knows, when we look at someone else's problem, we look at it in a different perspective to what they're looking at it themselves. So it's important that you share how you see it and get somebody else's perspective, because they'll see it totally differently. If your depression persists over a longer period of time and you are noticing either behaviors, moods, attitude, etc., shifting and changing, and it's not shaking, as they say, you're not able to shake off your mood, you're just kind of really, really stuck in a rut, then it is important to get help. There's lots of different types of help, but my suggestion to you would be, to go see your doctor or your GP or your psychiatrist or whoever, and say to them how you're feeling. Give them your symptoms, and let them see what they can do for you. Try, if you can. The best way is to go the therapeutic route first. There's lots of holistic therapies that you can use. There's cognitive behavioral therapy as well, which will help with depression. If it's a case of getting medication, kind of leave that to the last resort if you can, and even explain that to your doctor. Over the past years, there've been a lot of people who become dependent on benzodiazepines, like Valium sedatives, and they're very hard to come off. So I wouldn't encourage people to go on them too soon. Maybe as a last resort or for a very short period of time to get you over the kind of edge, but not over a longer period of time, because they can be dangerous in that sense. Righty-ho, so just going to summarize this. So we just looked at what depression is, the different types, just feeling depressed, clinical depression, and there's lots of different types of clinical depression. I suppose a common one would be bipolar disorder. That would be a common clinical diagnosis in that sense. People with addiction will get dual diagnosis, and again, bipolar would be one of those, part of that dual diagnosis as well. Why would I feel depressed? Well, again, for any reason. There's no set thing that can say you will feel depressed because of this, that, or the other. We're all different, and some things will affect us and some things won't. And what help can I get? And again, as I say, there's plenty of help out there, but you need to ask for it. That's the main thing. Willing to say, well, look, I'm struggling here and I need the help. Right, well, that's me, and I'm finished up here now. So thanks very much for watching. And my next slideshow will be on anxiety. So I'll see you over there. Okay, thanks and have a great day.